And now this is the last discussion of our today's panel. Yes, so we'll discuss on
what are the ethical and the legal aspects of oncofertility.
So basically, I would like, so this is like a open to everyone. So you can comment like it should be offered to whom, and what about the financial considerations, and what about the disputes, and these things, and about the posthumous assisted reproduction. So I think the first two questions I would like to ask to our oncologist, their opinion about to whom they would like to offer, and what about the financial things, and other part we can discuss. So first I would like to ask Dr. Bagal on these 2 points. Like, would you like to, ideally, yes, as per the guidelines said, it should be to everyone?
Yes, so I think, as you said, no, better to have the discussion upfront rather than later on regretting the thing. And it should be considered in each and every patient, especially given the improving outcome nowadays. And I think facilities are also becoming available to us.
Yes.
Even we have some strategies to, for example, to buy some time or tide over the crisis. Meanwhile, we can do this. So it should be definitely at least discussed, and appropriate assistance can be taken from our respective colleagues.
Yes,
as far as
sure.
financial consideration is concerned, this is sometimes a challenge, definitely. And the cost of treatment also has to be kept into mind, and some of these techniques are really something to think for our routine or maybe general category patient. But definitely having guidelines on this, getting them approved through the insurance and reimbursement through their service provider is important. And that is why the point which was discussed about having guidelines for our patient is important, so that they can get it reimbursed. So definitely there are challenges, but we need to be active and think about this in the first go, so that we give them the chance not only to be cured but have a normal life afterwards.
Yes, sure. So I would like to ask Sampada ma'am also on this, like how we can, improve this, and collectively together we can improve these 2 aspects. So about the counseling to be offered to everyone, and mainly the financial concerns.
Yes, counseling is to be offered to everyone.
Yes.
We need to take into consideration the prognosis of our
Yes.
Stage 4 CA cervix. I will not.
Sure. So all the curative treatments definitely will go for,
early
not
stage,
the palliative ones.
But the counseling is to be offered to everyone,
Yes.
so that everybody is aware of this thing. Another important comment I want to make. It's good that you are doing this oncofertility workshops.
Yes.
It is not that every oncologist or everybody who is treating cases are aware about all these techniques that are available.
Correct, yes.
Even in the rectal cancers, there are patients who receive neoadjuvant chemoradiotherapy without ovarian transpositions.
Correct.
So these things making the oncologist
Aware about
because the gynae oncologist might be aware about the ovarian transposition, but the radiation oncologists sometimes are not, may not be, because those techniques were not available at that time. So it is important that we make this awareness among the oncology community also, that such techniques are available.
Yes, and each field, sorry to interrupt, like not just gynae onco or pediatric onco or just hematological. So it should be each and every oncologist should be aware about it, and especially who is dealing with any patient of the pediatric, young adult and the reproductive age group. So I think that is very, very important. So we have to reduce this information gap between us. Yes.
Financial consideration, yes, it is fertility treatment. The moment something comes to infertility, the insurances don't support, but I think something should be made about it, because it is the quality of life that we are looking.
Yes.
Especially these early stage cancers are long-term survivals, and we should be looking at the quality of life issues.
Yes.
And insurance consideration should be
should
given.
be there. And probably, ma'am, as NGOs, they are looking, because I think I saw in the conference also we have a workshops on NGO. So I think there also they can, discuss these topics, because this is also one of the factor of the cancer patients when we look at the person whole and the complete well-being. So definitely this factor matters a lot. And so that is one. And of course, insurances companies should consider this as a iatrogenic complication of the cancer treatment. So definitely we should have some consideration. So I think the right guidelines and some kind of the consortium will definitely help on this. Yes. And then to our fertility specialist, I would like to ask, like, whenever can you comment on this, like disputes on the frozen gametes and embryos, and about even the posthumous assisted reproduction. So first I would like to ask Dr. Chaitra on that, how we can prevent that. Especially you can tell a little bit about the consents and other things, the importance.
Yeah, very important in our field, infertility, to explicitly take consent from the couple, if the couple is married, as to what happens to the gametes, individual sperms and eggs,
Yes.
or the embryos which have been formed, if at all they separate or one of the couple dies. That is
Correct.
important, especially also if the one of them has got cancer which has a higher risk of having morbidity and mortality. So it's important to be explicit on the consent form as to what happens to the fate of the gamete legally. So that should be mentioned from both the husband and the wife, and individual consents are taken, not as a couple.
Yes.
So we take one from the husband and one from the wife, so that legally tomorrow, if at all there's a dispute, not necessary that the husband or the wife, the cancer person should die. If at all they are unable to take a call, they lack the competence to take a call, then the fate of the gamete should be decided from that piece of paper. So it's important that we document it and store it in a safe place. So
Correct.
that's important.
So that is very important for the documentations and the consent parts.